Before COVID-19 came along, life was already challenging for the 4.4 million Australians with a disability. Now, it's tougher than ever.
Day to day for disabled people, we have seen an increase in fear, an increase in uncertainty.
Families are really scared. No information is coming out that's tailored to their needs. Families are having their core supports under the NDIS cancelled and they don't know whether to send their kids to school.
Shortages in food, no access to hand sanitizer or gloves, items they desperately need, all because people continue to panic buy. And while the dedicated hours at supermarkets have been some help, they just aren't feasible for everyone.
These time slots do not work for disabled people. Early mornings, 7 a.m, 8 a.m, require disabled people to get up at 5:30, 4 o'clock, be able to get dressed, get sorted, get on the road if you can. It's almost impossible to get a support worker.
In fact, it's getting harder for them to access all kinds of essential services.
The added fear for us, as many of our service providers have withdrawn services from us, or we have had to cancel them out of fear of coming into contact with this virus.
A recent survey of families of children with disabilities found 81% have been unable to buy essential supplies, 23% have had support workers cancel on them, and 82% feel they're not getting the info they need to keep their children safe. They're also not getting the same financial support as other Aussies. While the government boosted a range of welfare payments by $550 a fortnight, people on the disability support pension will only receive 2 standalone payments of $750.
What we have not seen from the government is that kind of targeted plan to reassure us that there will be a continuity of essential services that we need for daily life.
Sue Tape's 8-year-old daughter Eliza has Rubinstein-Taybi syndrome, and the current crisis is ringing alarm bells.
Her body just isn't as strong at times to fight respiratory bugs or bugs like that. There's been a lot of discussion about children being asymptomatic, but if schools are still open, how do I protect my child from such asymptomatic children who are still carrying the virus?
The mixed messaging on schools is making everything else that extra bit harder to manage.
In the absence of some of the really clear information, we've had to think months ahead about medicines, continence products, had to cancel appointments and think about where our family member is going, who are they meeting with, what activities can they still do, what they can't. It's quite challenging and very, very stressful.
The biggest thing these families need right now is support, and lots of it.
We need to be working together so that everybody is protecting everyone.
We can't wait a week, we can't wait 2 weeks, it has to happen now. This situation is escalating very fast.
We need to urgently establish and see established a national hotline for disabled people and our families so that we can get the information that we need so that we can get through this crisis together.
Well, Ellie de Marchelier has cerebral palsy and is a disability advocate, and she joins us now. Ellie, what are some of the challenges that you've had to face because of the coronavirus?
Look, just like most families, we've had to deal with how are we going to isolate ourselves and keep ourselves safe. But I think the difference is with having a disability and having underlying health conditions, we've actually been looking at this for weeks now. I've been in isolation for quite a number of weeks, and we've already been planning for a long time about how I have a month's worth of medication. How am I going to get my support workers in? If they're sick, how are we going to make sure that I can get showered and fed and all the things that just keep our household running. So just like everyone else, I'm dealing with having to homeschool a teenager at the moment and keep our house running. But there's that extra layer of how do I keep myself safe, knowing that if I was to get coronavirus, I would most likely not have mild symptoms. And that's the reality.
Are you finding also that support workers don't want to come in anymore, or you're getting less access to those services because you're isolating?
I think it's definitely a mixed bag. I think some support workers want to stay close to their families and look after their own kids who are at home. And then I think it's also that people with a disability don't feel like there's been enough government help around training support workers, around making sure they have the skills and the tools to keep infection low, how to respond if someone is sick. So I think people with disability are also feeling like, is it safe to have these support workers in my home if they're not trained up in those skills?
Ellie, what would you like to see the government doing to support people with disabilities at this time?
Do you know what? I really want them to listen to us. I really want them to talk about us. At the moment, we are just being left out of this conversation. So if you look at, for example, at that COVID-19 supplement, the extra $550 a fortnight, that was not extended to the disability support pension. And that's someone living on less than $300 a week. I just went to the pharmacy yesterday to get a month's worth of medication, and it was well over $200. People with disability are having to make sure they have all the supplies they need to function for a couple of weeks and don't have the finances to fund that. But we also need to make sure that when we're communicating about this disease, we are including people with disability. We need to be at the table.
Ellie, I want to talk more specifically about people with intellectual disabilities. Is enough being done to communicate what's going on in the world to them?
Look, Pete, if you and I are confused about whether we can go to the hairdresser or not, could you imagine having an intellectual disability and trying to understand whether it's safe to go to your usual shopping centre or it's safe to pop down to see a mate down the street that you do every day and that's your routine? If we're confused, if the messaging is too confusing for us, then no, not enough is being done. But I do know there are some great organisations out there that advocate for people with disability who are creating easy read resources, easy English resources that step people through this in a way that they can understand.
Ellie, you mentioned you've got your family around you and a teenager there. Are you worried about particular individuals you know who might live alone, who don't have their support workers turning up?
Yeah, I am worried. And I'm worried because I feel like they have been left out of this conversation and we are, right on the edge of something huge and we should have had this in place earlier. But I do want to say to those people, there is hope. People are thinking of you. People are working night and day to advocate for you. And if you need a hand, reach out to a neighbour, reach out to family. The disability community is strong and it is proud and we have got your back and we are thinking of you.
Well, thanks so much for your time, Ellie. It's really important perspective that you provide us, so we appreciate it.
Thank you for including us.
I think a really important point too is, the gloves and the sanitisers that everyone's been panic buying and stashing at home. These are essential items that disabled Australians use every week to clean catheters, to change. You've got people that have had chemo that have ports in. They need these every week to be able to do those medical procedures safely. So if for some reason you are stashing it, you don't need it, and you know someone who has a disability who might need it, I think it's a great time for us to reassess, do we really need to have that stuff in our houses?
Yeah, I feel like, that's a really powerful example of it. But the panic buying thing generally, if we don't get it sorted, it's going to cause a problem. It'll cause problems like that. But also, just if you're the one who has all the soap and no one else can get it, you're more at risk.
Yeah.
Because they're not going to be able... Do you know what I mean?
Yeah, it's a great point, isn't it?
It's all this sort of interdependency, I think, that we need each other at the moment. Yep. And we need to look out for each other for our own sake. I feel like that's the big lesson that's coming through all of this.
It's an act of love.
Yeah. Yeah. That's a really powerful way of putting it.
And what a wonderful advocate Ellie is.
Yeah, absolutely.
Amazing.